Well, we are going to move on to our next work session then. I see that Alex Baum is here with the Community Foundation to take us into this work session. So we'll make that transition now.
Mayor Kavanaugh, members of the City Council, Mr. City Manager, and City staff, I want to thank you so much for inviting me here for us. It's not usual to start with a complaint, but I do hope that next time there'll be a less inspirational group leading into my presentation. It's a little bit of a tough act to follow, but for the, for a city partner who is very engaged with this idea of civic engagement and civic involvement, programs like City Life and the city staff who run them and the leadership of Dubuque for putting forward programs like this, it's really impactful and it means a lot, and I was very privileged to have a small role to be able to play in it this year. So thank you so much. I don't know if we have a different slide deck that will go in, or if I should be changing it on my end. All right, so thank you so much for the invitation to come here and speak to you a little bit about the partnership that we have together and the work that the Community Foundation has been doing through Project Hope and through Engage Dubuque, kind of around these ideas of economic mobility and civic engagement. This partnership has been going for over a decade, and the investments that the City of Dubuque has made in these programs are multiplying their impact. Since 2023 alone, we estimate that we brought in more than $1.6 million in related grants to these different programs and created an $8 million impact investing fund. That kind of additional programming and work is not possible without the support of the city and this long-term partnership that we've had to be able to build these programs. We're leveraging this kind of collective work with the city staff and with other partners to really try to multiply the impact that we're having in the community. Now, I have a lot of things to try to get through, and I know we have limited time, so I'm just going to move through, but I want to start by talking about Project Hope and the work that we've been doing around this area. So for those of you who aren't aware of Project Hope, it is a collaboration of local government, nonprofits, other stakeholders in the community coming together to address issues of economic mobility and poverty reduction. It's really focused on data and research to a large part, and it is all about collaboration, partnerships. How can we address some of these issues on a systemic level? Now, with the city, we have previously been working very closely with the Office of Shared Prosperity in accordance with some of the equitable poverty reduction and prevention plan that was put out. And now in the past year, we've been working in very close partnership with the Office of Community Impact and Neighborhood Support, and have been working closely with the new initiative that the city is doing around economic mobility, right? Part of the reason why there's this close collaboration is we want to leverage Project Hope, leverage the work being done in this community so that we aren't recreating wheels, but are really moving the efforts of the city as a whole beyond into much larger areas. This focus on economic mobility by the city comes at a great time because we just held a data walk last year that was entirely focused on this issue. So we have a lot of the data that we need to be able to move forward. Now, I know that some of the people here today were able to attend the data walk, but because some others haven't, I wanted to run through very quickly. So a data walk is where we take up community level data and put it kind of like a museum exhibit around the McCarthy Center in the Roshek building just across the park here. This year, the data walk was based around data by a group called Opportunity Insights that comes out of Harvard University with Dr. Raj Chetty, that's really focused on economic mobility and different impacts in different communities around the country. This had some pretty remarkable findings when we took it down to the community level. So this is a chart up here showing the household income at age 27 for a child born in 1978 to low-income parents. So parents who are low income in the 25th percentile, their child, what is that child's income 27 years later? Have they been able to break out of the cycle of poverty? Have they had economic mobility? So at the bottom of this purple chart, this is every county in the United States from bottom with the lowest economic mobility up to the highest economic mobility at the top. Dubuque came in the 92nd percentile of every county within the United States, which is pretty remarkable. But this is every county. This includes massive counties and also very, very small counties. So there's a lot of change in the data. There's a lot of uncertainty there. So to the right, we have every county with at least a population of 60,000 people. So every county at least the size of the city of Dubuque. In this recording, Dubuque came in third out of every county in the United States. Which is a remarkable story. That means that Dubuque County had one of the highest levels of economic mobility of any county within the country, according to this very high-profile study that went out. Now, part of the question is why, and we looked at a lot of different indicators, job creation, share of single mothers within the community, a lot of different things, but I just want to talk about one, which is this idea of economic connectedness. This has to do with social capital, and it's really the question of, do people in a community form relationships across socioeconomic levels, right? Are low-income individuals able to form relationships with high-income individuals? Dubuque scores very, very well in these areas. And what is so interesting about this is the researchers found that this idea of economic connectedness had the highest correlation with economic mobility of any indicator that they looked at and studied. So it was the idea in Dubuque that relationships, who you know, the connections that you have, that not only matters in how we operate in the city, but that it has been an engine in this community driving economic prosperity and driving economic mobility, right? This is a tremendous kind of finding and really speaks to what I think the experience of a lot of residents have had in Dubuque, that there is a small town feel where you're able to get to know people and be open to different opportunities and resources. But the question that this introduces is, what about those people who haven't had that experience, right? There's a lot of disparity in this community. If we are such a huge engine for economic mobility, why hasn't everybody experienced that? And I think there's a lot of questions to that, answers to that question, but one I just want to touch on quickly comes from this slide. So this slide shows that for household income for adults, for a child born to low-income parents, Dubuque ranked in the 99th percentile of every county. For household income for children who were born to low-income parents and stayed in Dubuque, grew up in Dubuque, and then stayed in Dubuque later, we're the 96th percentile, top of the country. But for change of household income overall, we were in the bottom 10%. Now, when I first saw this, I was kind of flabbergasted. I assumed that there might be a problem with the data or something. How are we ranked so highly for household income in these categories, but not in this other one? And while I think there are a number of answers, one that stands out to me is the idea that if it is people who have grown up in Dubuque and who have lived here as a child and built relationships who are having a lot of this income growth, then it must be newcomers who are bringing down that average. Which leads to the thought that Dubuque has had a lot of demographic change over the past 30 years. There has been a lot that has happened in this community. And if we want to keep that crown of being third in the country, of having such a high rate of economic mobility, we need to worry about this tight network that we have perhaps being a barrier if you're located outside of it. How do we open that up? How do we allow newcomers to this community to be able to engage and make relationships? I actually think city life is a tremendous example of something like this, allowing people to come in, build those relationships, build those connections, and have it as part of the city's underlying infrastructure. I think this is a tremendous step forward for the type of work that we need to do to keep that high level of economic mobility. Now, for those of you who haven't seen this and are interested, we still have this up at the McCarthy Center in the Roshek building, but it won't be up for too much longer, and that's because we've already started working on next year's data walk. which is going to be focused on affordable housing, ranging from everything from what is being built in terms of affordable housing to rent and utility costs to homelessness. And what we want to do here is bring new data into the conversation and be able to bring people together and have a discussion about what's going on. I have an enormous Excel spreadsheet right now on my computer that I'm very excited to dig into. When I tell most people this, they break eye contact and say they have to go pick up their kids somewhere, but I think we'll have a tremendous lot of information and data to be able to share with you. And this is also very relevant to the work of Project Hope, because Project Hope as a collaboration has been focused on affordable housing so far in 2026. This has involved analyzing new data on evictions and discussing it as part of the group, coordinating on housing support, and most recently trying to map out the affordable housing and homeless support systems in Dubuque. Now, I'll kind of give you an example of what that means. I'll show you what it means. So this is the center part of the mapping that we did, was trying to look at what is the journey of somebody experiencing housing instability in Dubuque, right? What are the different areas that they're focused on? Maybe avoiding eviction and foreclosing, trying to find new rental housing, finding support while homeless, right? And then from this map, we found all of the different needs and the gaps that somebody might need there, ranging from food insecurity to support with rent or being able to get temporary shelter. Then we added onto this all of the different services that addressed those needs, and finally, all of the different service providers within our community who are providing these different needs. So Project Hope worked through this map together, and then we shared it with the Homeless Advisory Council as well. And in the end, we came up with 111 different entities that are providing services connected with affordable housing and homelessness support within our community. There was a wide range, and no one entity was listed for more than 23% of the different services that were there. It was actually the city of Dubuque had the highest number of services that were being addressed. This is a lot of different entities that are being looked at, and this Thursday we actually have a Project Hope meeting where we are going to dig into this more. But I believe that this idea of navigation and casework is key. With that many entities, in my opinion, it doesn't matter how well you can make referrals. It is challenging for a single mother facing homelessness to be able to engage with that many different service providers in order to get the help we need. There's just a limited bandwidth that we have as human beings to be able to address that. So how can we as service providers and community organizations help expand that bandwidth or help walk along people so that they can access the amazing resources that we have in our community? Next, I want to talk about the Better Together Committee, and I apologize, this is a bit of a typo. We're actually going to talk about the Food Provider Network a little bit later in the discussion. But the Better Together Committee is another collaboration that we run that is focused on systemic barriers facing our immigrant populations. So why is this a priority area that the Community Foundation has partnered with the city on? Well, between 2010 and 2024, 97.8% of the population growth in the city of Dubuque is due to growth in immigrant families. 97.8%. Within the Community Foundation's 7-county region, which goes from Allamakee down to Clinton, that number is 264%, meaning that our region without immigrant families would have shrunk, and pretty significantly. And it's not just demographics too, but it's also workforce. Between 2010 and 2025, we estimate that about 37% of the growth in workers within Dubuque County is due to the growth of the foreign-born workforce. And if you look at those individuals who are in different industries within our community, 514 manufacturing employees is like 127% of Simmons Pet Food. Healthcare and social assistance employees is about 42% of Finley Hospital, and 323 accommodation and food service employees is 116% of Diamond Joe Casino, right? This is more and more immigration is becoming a key part in our demographic, our economic, and our civic thriving as a community. And so the question is, how can we as a community work together to make sure that those groups that are coming here are thriving in the way, are getting access to good jobs, are being part of that workforce, are getting what they need in their community to really be able to thrive. And so from that came the Better Together Committee, which is a collaboration of over 90 stakeholders, and nearly a third of those come from immigrant populations themselves, who are there to address the needs and priorities of different immigrant populations. This began with an immigration community assessment that we conducted, but so far over the past year, we trained over 20 different local community members that are Spanish and Marshallese speaking in medical interpretation, and created a database where now anybody can access them. And we're actually launching a messaging campaign this month to try to get the word out to healthcare providers and businesses that we have trained local interpreters here that can address needs ranging from doctor's appointments to how do you do a safety training at your manufacturing company for Marshallese employees. We talked about navigation before as an important part of the affordable housing system. We also created a navigator resource group for those navigators who work with immigrant populations so that they have additional support and a place to be able to meet and share best practices and support each other, because our research found that burnout was a major problem for some of the navigators within our community. We've also been we held our second International Student Welcoming event down at the River Museum, and have been working a lot with the international students at our colleges. We bring all of these talented, smart, hardworking people to Dubuque, and unfortunately, we lose them when it becomes time to find them a job. How can we work better to retain that population who are coming here? And finally, we have also just launched 2 new projects that we're working on. One around youth leadership, which it thrills me to see the work that City Life has been doing in IJAG in getting youth engaged and doing leadership work, and then also one to re-up some of the research and make sure that we are still targeting the priorities of our immigrant populations. There's also one other big project that we have been working on in partnership with the city, Mary Rose Corrigan, a number of other staff and other partners, that is around, at a time when people are maybe withdrawing from public spaces, how can we get good, trusted local expertise out to different families, right? How can we make sure that people are listening to the public health providers or their doctors instead of whatever their uncle sent them on WhatsApp? And so we have been putting out messages in Marshallese and in Spanish through trusted community connectors focused on things like, this is about healthy nutrition. We've done vaccine availability, child safety, but also different legal issues. I just finished today sending out to translators information about Iowa's new hands-free law for driving. How can we get that into Marshallese and Spanish so that our population knows what the law is and knows how to behave appropriately? So this is an exciting new program that we are working on, and it is our hope that this will eventually evolve into a type of community journalism, where it's actually individuals from within those communities producing stories that their communities need to know in the languages that their communities may speak. Finally, I want to go into Envision Dubuque and talk a little bit more about this civic engagement idea that was really led into with City Life. So this past year, we finalized Envision 2030. We were able to collect over 3,000 different community ideas about how to better Dubuque and this city, and we brought them all down to a top 10 ideas, and now we continue to support working groups of residents who are trying to lead those ideas to fruition. So just to update on a couple of them, we don't have time to go through all, but for example, our working group on community-centered housing is now focused on 3 areas. One is around advocacy for tenant rights and the rights of residents of mobile home communities. One about rehabilitating some of the multifamily homes that you might see up on the north end that are degrading in quality, but that could be renovated to produce some of that missing middle housing. And then another one on resident support, tenant support. How do you help people be able to not only get a new home, but get furniture for that home and get connected to resources? Or an interesting element that was added, How do you help residents move out sometimes? Low-income residents often don't have the resources to be able to get a truck or a moving van, and so leave their furniture behind, move into a new place, and have to start all over again. The Heart of Age Play All Ages Sports Group has developed a 6-point action plan that includes a feasibility study and site identification for a new sports complex within Dubuque. And the Captivating Shorelines Group has been working on how to take Mouse Park and Lake and renovate that, work on the JC Floodwall Trail and Volunteer Drive, and then the Shot Tower in Northport industrial area, how can we make those places more accessible and have more amenities connected with the river? In addition, there's a number of other kind of pieces of work that the Community Foundation has been doing connected with this. One of the big ones I want to bring up is the idea of grad partnership. This is a new program that we've been launching with Johns Hopkins University, bringing technical assistance and a evidence-based approach to different schools within our region that is really focused on reducing absenteeism, which was a big problem after the pandemic, and improving student support systems. So through supportive relationships, using data, and really a student-centered mindset. And then other efforts, there is a new summer learning cooperative who has just put out a website for different summer camps that parents can access throughout the community. So if anybody's listening online and you want a summer camp for your kids, there's a website that details every single one and that is filterable and searchable. Our journalism work, we are the only Press Forward chapter in Iowa and are now focusing on trying to build out community journalism. I want to take a moment to talk about the food provider network too, because with the changes to SNAP that took place at the end of November, this network was meeting very closely in order to share information and really respond to those changes. And then when funding challenges and different kind of shifting priorities have hit this year, and we were losing food pantries and meals at St. Patrick's and the DCSD Family Pantry, the food provider network was able to come together and find replacements, find other organizations to be able to take this on. We've spoken in previous discussions about kind of our systemic stability, right, our resiliency as a community, and what happens if a service provider were to fail. I think what this shows is that collaboration, especially in a group as diverse as the Food Provider Network, can be a huge bolster to systemic resilience, right? Being able to take those issues and those gaps that might spring up, and if we're talking with each other, we can respond to those different situations. And finally, Iowa has for a long time not received the green funding, the environmentally focused funding of a lot of other states. And this year we hosted a convening of over 50 different groups coming in to discuss how can we partner together and maybe bring some of that funding into our region and help supercharge some of the programs that are going on here. So that was a quick run through. Thank you so much for your time. And if you have any questions or anything I can go to, I would love to be able to talk more about it.
Yeah, well, thanks, Alex. You covered a lot of ground, but that's what you guys do. You do a lot. So I really appreciate you running through everything. We do have a few minutes if people have any questions or want to make any comments. Yeah, Ms. Bethel.
I just wanted to, well, first of all, thanks for all the numbers and all the information. You always do such a great job. To dig just a little bit deeper into the upward economic mobility questions, I think it's slide kind of 15 around that area that you shared, and you shared that your thought was that these, that the reason that we fell behind in the change in household income in Dubuque ranking is potentially because we have newcomers. Those newcomers are, for the most part, immigrants. And so can we correlate that into a need to look at immigrant services specifically? I mean, am I stretching too many, chaining too many things together, or would that be?
No, I would agree with that. It can be hard to know exactly with this data, right? It points in directions and gives things, but my conclusion is that Dubuque has been built on this idea of relationships and close connections. And, you know, part of The way I found a job was through connections when I was moving to town. You know, my family, my wife's family who was living in here had relationships, had people, and they said, hey, do you know of job openings, right? That's how I learned about the Community Foundation, that there was a job availability there, that was a good fit for my skill set. If you are a Marshallese family coming into town, right? If you have language barriers or relationship barriers, if you have a cultural unfamiliarity with the systems that are in place, that creates levels of system within our community that maybe we don't have the formal infrastructure to be able to replace right now. So how do we do that? And I don't think it is just with immigrant populations, though I think those are some of our fastest growing ones. If you look at which 80% of families in Dubuque County are married families, and about 17% are single mom, and the remaining are single father-led households. But if you look at families below the poverty line, 57% are single mother-led households. So over half of all the families below the poverty line in Dubuque County are led by single mother households. That is another group with limited social connections, limited relationships, and frankly, if you're working multiple times and trying to raise your kids, limited time to go out and build those connections and those relationships. I think that's why the great work that nonprofit organizations are doing to remove those barriers, to build those social connections, and to make sure that we have greater accessibility to the pretty remarkable resources we have in this community, why that's such important work that we need to continue.
Well, and it struck me, Jeremiah spoke about social determinants of health and the importance of looking at somebody's, as it relates to all the things that really call for economic mobility, your transportation, your resources, those things. It makes me wonder about how we could craft a city life like group, but really reach out to folks who have issues with economic mobility and target those folks, because that could be the bridge of connection and the bridge of understanding. And so just trying to even dial in further our city life group, although funds and those things, but in dreaming big, I think that would be a really great way to maybe target folks specifically who could use that upward mobility momentum.
I couldn't agree more, and I will say that the Office of Community Impact has been doing a great job. They've actually offered City Life in both Spanish and Marshallese for community members, which I think is absolutely tremendous. Can we build on that more, right? Can we get more people from those communities engaged in what the city is doing?
Thank you. Yeah.
Well, Alex, thank you. I think we're at 6:26. I think I saw some members rushing in right before this meeting, so I'm going to give them a chance to take a breath before we go to our next our full meeting at 6:30. Thank you very much for
Thank you
being
so
here
much.
and providing all this information. Looking forward to the next data walk. Thank you very much.
We'll let you know when the date is.
All right, sounds good. All right, well, there's no further business in the work session. We will reconvene in a few minutes at 6:30.